Your mouth is
Skittles.
big, Cat.
So if you got it right at the
Skittles.
beginning of COVID,
So we
wait,
would
I'm
like to
not
start
seeing any
now.
no captions. I'm not seeing captions. Is everybody else?
No. Okay,
Well, now they're back.
No,
back.
okay.
Okay. Okay. I'd like to welcome back those of you who've attended our meetings in the past, and a special welcome to newcomers. For those of you who are not experienced Zoom users, if you wish to see closed captions, there is a button to click at the bottom of the screen. You can move the captions by moving your cursor on the caption box and moving it. If you keep the chat box open, you will avoid the orange chat icon popping up and covering the captions. If you prefer not to see the chat, you can drag and drop it to the side of your screen. Please also click on mute so that we don't hear background noises such as sirens and dogs in your house or apartment. We are recording this. When the recording is ready, we will post a YouTube link on our website for others who missed it tonight. Many of you are probably aware that the City Council passed legislation in December mandating that movie theaters show a certain number of open caption films. The legislation goes into effect on May 15th. Because this is something many of us have lobbied for, now that it is here, we feel an obligation to attend those presentations. Our newsletter and Facebook page will provide information for finding these showings. So please show your support by going to open caption showings. One of the prime movers behind this initiative, Jerry Bergman, is here to speak briefly about another important initiative. Jerry is chairman of the HLAA New York State Association's Advocacy Committee. Jerry?
Thank you, John. I'm excited because we're on the verge of having our state legislature pass, both houses pass, the governor sign a bill to create the Commission for the Deaf, Deafblind, and Hard of Hearing in New York State. Those of you who've attended HLA conventions may be familiar with the fact that most other states have such commissions at the state level that really does wonderful work for each of our three distinct disability groups. In this push for such a commission, we're allied with the Empire State Association for the Deaf and Deafblind Legislative Advocates. But we've been a prime mover, and just a few days ago, our state organization sent an action alert out, which some of you may have gotten and others may have gone into your junk mail, or you simply missed it. So I want to tell you briefly where we are and how you can help. Yesterday, the Assembly Government Operations Committee, chaired by Assembly Member Zabrowski, who happens to be the lead sponsor of this bill, passed it unanimously, and tomorrow it's expected to be voted by the full Assembly and expected to be passed, which means that we need to push at the moment on the state Senate. And I had a conversation today with the legislative director for the lead sponsor, Senator Skoufis, and was told they're pushing to try to get it on the Finance Committee agenda in the Senate as early as the end of this week or next week. And that committee is chaired by Liz Kruger, who I believe is from what used to be called the Silk Stocking District on the East Side. So if any of you are in Liz Kruger's district, please email her as soon as you possibly can and ask her to get this bill considered as soon as possible, because it's very important. New York is one of only 12 states in the country that doesn't have such a state organization. And just last week or 2 weeks ago, New Jersey allocated almost $1 million in funding to improve accessibility for people with varying degrees of deafness. So it's really important. If you look on the chat room, or if you can't see it, I tried to post the numbers for the Senate bill and mentioned the Assembly bill as well. If you don't know who your state senator is, there's a website I posted there where you can quickly find out who that is and whether or not they're on the Finance Committee in the Senate. You should email them and say, this is important. Please do this. I'm a constituent and I need this kind of support from our state. I'd be happy to stay through the end of the meeting and can answer any questions anyone has at that time. And David Landsberger's agreed to send everyone the information I mentioned that I posted in the chat.
Yeah, I had sirens going by and I muted myself. Thank you, Jerry, for that. It's very important legislation, and I would encourage everyone to show their support. I am very excited about tonight's program, which I think you will find interesting. The past couple of months, we've heard from several distinguished audiologists who have spoken about the current state of audiology. Tonight, we will get a different perspective on the field, how it is changing and where it is going. I will forego lengthy introductions of our panel, whose bios you will see on their PowerPoint slides. I will say that we are very fortunate to have Dr. Barbara Weinstein here. Barbara is a prominent educator of audiologists. She received her PhD from Columbia University, where she began her academic career. Currently, she is professor and founding executive officer of the Health Sciences doctoral programs at the Graduate Center of CUNY. In addition, she's an adjunct professor at NYU Langone Medical Center. Tonight, Barbara will be joined by one current student and one recent alumna of the CUNY program, Alexis Leiderman and Dr. Sophie Racine, respectively. Dr. Racine received her Doctor of Audiology degree from the CUNY Graduate Center and currently works at Montefiore Medical Center. Alexis is a third-year audiology student at the Graduate Center of CUNY and will be at New York Presbyterian Columbia University Irving Medical Center for her residency. When the panel is done, if you want to ask a question, please click on the Reactions tab at the bottom of your screen, then click on Raise Hand. You will need to unmute yourself to speak. In order to give as many people as possible a chance, we do request that you keep your questions to 1 minute. When you reach a minute, you will be cut off. If you need to ask a follow-up question, you will be given an additional minute. Barbara, take it away.
Okay. So I want to say hi to Phyllis Rubin before I start. Phyllis, do you hear me? Okay. Okay, thank you for including us and inviting us. Nancy was a mover and a shaker in getting us together and getting this program going. And one of the rationales for this was to try to bring in some young people and spread the word about HLAA through young people. And we wanted to share with you some of the activities that the younger generation are involved in. Both Sophie and Alexis are very active. Sophie professionally, and actually Alexis professionally. So starting with Alexis, who's the president of the Student Academy of Audiology, a national association. And she brings her passions to audiology because her younger brother, right, he's younger, right, Alexis? Yeah, he's younger, is deaf and is a cochlear implant user. So she's an amazing advocate for him as he is for himself. And Sophie is one of our star graduates, and she's working at Montefiore Medical Center And she's a very strong advocate for hearing impaired. She worked very closely with children at Montefiore Medical Center. So let's start. And before I actually we get started, we're going to be talking about inclusivity, the importance of inclusivity, and some of the activities. But does anybody have any, quickly, if you want to put it in the chat, any kind of information that you want to make sure that we touch on? If you could put it in the chat, I'll check the chat while we're speaking, because we want to make sure that this is, we cover whatever areas are of interest to those of you in the audience. So what I will do is now turn it over to Sophie, who will explain how she ended up going into audiology and some of the way audiology is hopefully changing as a profession.
Okay, thank you, Dr. Weinstein. Can everyone hear me okay? Yeah, thumbs up if you can hear me okay? Okay. As Dr. Weinstein said, my name is Sophie and I'm working at Montefiore Medical Center. I decided to go into audiology for a couple of reasons, but mainly I had a really great relationship with my audiologist and she inspired me to pursue this career. I was diagnosed with hearing loss at 2.5 and got hearing aids at 3 years old. I was mainstreamed in school here in New York City. It was challenging because a lot of the teachers were not equipped to accommodate a child with a hearing loss. I was one of the first few students with hearing loss at that school. My parents and my sister, however, were amazing advocates, and I learned how to be an advocate for myself. And my family, we did not really know other people with hearing loss or other programs. So I kind of felt a little bit isolated because I was sort of one of the only people that I knew in my life that had a hearing loss, besides maybe my grandfather. Before I decided to become an audiologist, I did work in investments for a little bit. I had an amazing boss who taught me everything about hedge funds and markets and etc. And I learned a lot. However, I always knew in the back of my mind that I was going to come back to audiology. I felt that I had a lot to offer from my own personal experience. So why audiology? I have been always interested in the advancements of technology. I have seen how my hearing aids have progressed in terms of the first analog hearing aids that I was wearing all the way to what I'm wearing now. I think a bunch of us here in this call can attest to that. I've also have always been interested in supporting family members and connecting with their loved ones, whether it's an adult or child, help bridging that gap in teaching them or showing them how communication can come in many different formats and helping them on their journey. And then lastly, I've always been drawn to interdisciplinary work. I studied in undergraduate, I was a gender studies major and it's very interdisciplinary. And since then I've kind of veered to professions that are interdisciplinary. And I think audiology is that way, where we work with many different professionals to help our patients thrive best.
But I just want to add, but we're not included in as many interdisciplinary teams as we should. And that's a very important part of advocacy that I know that I'm involved in and others are. And I just wanted to add also, Sophie, you want to just talk about your little pet and how your decision to get the pet and how your pet is helping you.
Yes, I have a dog, Ruby. She's a sweet 4-year-old sassy dog, but she also helps me in my apartment. She helped me alert me some sounds that I'm unable to hear. So I've been training her to help me with different kitchen sounds, and it has been pretty great relationship that we have.
Yeah, so Sophie asked me when she was a student, she said to me, she was going to be taking class in the summer, and she said, can I bring my I'm getting a new dog, can I bring my puppy to class? And I said, I'm not sure that they'll allow puppies in class. And then she explained it's going to be a hearing helper. So And hearing dogs are becoming more and more prevalent as assists for individuals with hearing difficulty. And there's some research that shows that these hearing dogs do reduce the handicap and the loneliness that sometimes people experience with hearing loss. So let me move to the next slide, Sophie.
Yeah, I think that was my slide is inclusivity. I think this is your slide.
Oh, okay. So I just wanted to mention this this report. It was Shari is not here, but I'm not sure if anybody saw this article that she published on qualities to look out for in hearing professionals. And I thought these were kind of interesting. And I wanted to kind of see, I mean, I can't get a raise of hands, but I just wanted to point out what we should be looking for and what you guys should be looking for. And I point this out to my students because I thought these are very, very helpful. You want to make sure that you're going to look for an audiologist or does your audiologist listen? That's very, very important. The audiologist has to be somebody who's listening. And when I educate my audiologists, my students, I'm always a proponent of person-centered care. And I underscore ad nauseum the importance of listening to your patient. Rather, the person with hearing loss should be talking more so than the professional. Communication skills are important. The ability to communicate rather than hide behind the technology is very, very important. I remember when I spoke at the HLAA meeting a couple of years ago when Catherine was the president, and I was doing a little survey and I asked people who would they go to if they wanted assistance in how to live best with hearing loss in terms of counseling. And many people said I would not go to the audiologist because the audiologist focuses on the technology, and that stuck with me. And it's really, really important that you look for an audiologist that's interested in the person and helping work with the person live and utilize the technology. Personality, you want somebody who's compassionate and empathic, of course. Ethical business practice. Ethics is very, very important, especially in audiology. I'm not going to go into it now, but ethics is very, very important. And you want to make sure that the audiologist has a lot of options available, because sometimes a hearing aid's not going to do the trick, but we have all this assistive technology that can help, and that the audiologist should be somebody who's also familiar with cochlear implants to know when to begin the conversation, because it could take 7 to 8 years before somebody decides to convert or transition over, and people are not transitioning over as soon as they should. And many audiologists don't feel comfortable talking about implants, and that's very, very important that the audiologist does. So this was a really nice article that Shari had written, and I encourage you to think about that and make sure that the person you're working with does have these qualities, and I try to make sure that students exhibit these as well. So now we have how to support the partnership, and that's Sophie. No.
That's also you, actually.
Oh yeah, okay.
Sorry.
Okay, so that's right. So when you're this again is from Shari, and basically it's a partnership. When you're working with the audiologist, it's a partnership. The audiologist has to understand that, and you as a person with hearing loss has to make sure that the audiologist understands that. So you want to advocate for yourself when you're working with the audiologist. It's very, very important, and we teach our students that they have to ask the patient to share their story, to start with sharing their journey. I don't think that that's happened in the past, but now more and more clinicians are working in that direction. We want to make sure that a partner, a family member, a close friend is present with the when you're going to see the audiologist, because 4 years are better than 2 years. And we want to make my students understand that people with hearing loss are much more savvy, and they're going to want answers to questions, and we have to stay up to date on hearing services and hearing devices. We want to make sure that I think audiologists should invite persons with hearing loss to come back on an annual basis just to make sure the hearing devices are working, see if there's residual disability, see if there's a need for additional technology. And there's a lot that the audiologist can learn from the patients. And I think that the advent of the OTC, apparently like by August, the FDA is going to release those guidelines, and more and more people are going to be looking to audiologists for assistance. And hopefully you'll, in the future, you view the audiologist as a partner in helping you learn how to live with hearing loss, live effectively, because hearing is essential to brain health and to well-being. And audiologists are encouraged to encourage individuals with hearing loss to engage socially, because engaging socially is protective, important for longevity. And I always encourage my students to underscore the fact that hearing and well-being go hand in hand. So that's kind of how I see the future. That's how I train my students, and hopefully that's the future of audiology, which is better for more and more people with who have difficulty hearing. So now finally it's going to be Sophie.
Okay, so one of the things I want to talk about is how audiologists can be, or how you hope audiologists can be more inclusive in the future. I think the perception of audiologists is a bit outdated, that all we do are hearing tests and hearing aids, and that's kind of how it is. I think some people have had difficult experiences with audiologists, not listening to them or taking the time to really hear what their needs are. Like Dr. Weinstein have said, I mostly am interested in younger population. And so I picked out some areas where I think audiologists could be more included, or where I think the future of where we need more work when it comes to audiologists doing it. So one of the things go hand in hand is noise-induced hearing loss. We often think is mostly occupational noise-induced hearing loss, but oftentimes it is, such as construction or MTA workers or musicians. However, I think people are not realizing that children are also being exposed to loud sounds, living in urban environments, listening to music loudly. CDC recently had a survey that showed 1 in every 6 students, high school, middle school student, is experiencing some measurable hearing loss from exposure to noise.
Can I just add one thing, Sophie? I just want to add something with the exposure to noise, which is really, really important for everybody to share with family members and friends. Individuals who are exposed to noise in the workplace are much more susceptible, according to the research, to developing hearing loss as they age. So hearing protection is really, really important early on, because if one is exposed to noise in the workplace, especially, their chances of developing hearing loss later on associated with it will take place, which is kind of important. So protecting your hearing, everybody here should be protecting the hearing that they have.
Whether you have a hearing loss, you should always be protecting your hearing, even whatever hearing you have left. I think that noise exposure goes hand in hand with the childhood education and classroom setting. I think our school systems are not equipped to help students learn the best because of the noisy reverberation that's happening in the classroom. While there is a standard that the schools need to meet in terms of the classroom setting of noise having to be at 35 decibels, and that the signal to noise ratio, meaning from the teacher's voice with the background noise, should be meeting the child's ear. The classrooms are not always designed that way. And again, the CDC survey has shown that 3 of 4 students say that they are exposed to loud sounds in the classroom. I think audiologists have a role to play in educating and sort of doing more work in setting up perhaps sound field systems, or helping set up better classroom settings for conducive listening. I mean, I think about this, my grandmother, she's 101, she was born and raised in the Bronx, and her elementary school is still standing there. I don't know if it's been updated. I can only hope that it's been updated, but it's still standing there. And so she was born in 1920, and that school was probably built before her. So I think that that gives you an idea of how the classroom probably could do some more work. I
And
think
especially with masking, especially we want to ask the fact that these kids are in these school, the teachers are wearing masks, the students, I don't know if they're necessarily wearing masks now, but many of them are. So the acoustics is problematic, and many audiologists are doing advocacy in the schools to get these sound field systems in.
any child, whether it's normal hearing or hearing loss, do struggle in those environments. Across the classroom settings, it's about 25 to 35 students per classroom. I think the pandemic has definitely shifted and helped gain momentum in the audiology field, where people are starting to recognize how difficult it is to hear people with the mask, but also how difficult it is to sit and do listening efforts on Zoom or Google Meet or whatever it is all day long when working from home. And I think I think HLAA does a great job of providing advocacy around the city. And I think we need to also, as audiologists, bring some more advocacy and awareness at the individual firms. I think young professionals, when they first apply for jobs, young professionals with hearing loss, that is, they are not sure whether they should even mention that they have a hearing loss in the interview, or should they wait after they got hired. And I think a lot of times young professionals also don't advocate for themselves, for their needs. When I was working in investment, I struggled a lot on the phone. It would really cause me a lot of anxiety. And those were important phone calls where I had to report quarterly or, any these data numbers that we were reporting. And it only took me, a good maybe 6 months to a year before I told my boss that I really think I need a different phone. And she worked with me getting an iPhone, so then I could stream all my phone calls to my hearing aids. It's ironic because I've always said I was a good advocate, but then I think once I was thrown into an overwhelming situation of a new workspace at a large firm, I, kind of shrink back and didn't advocate for myself as much as I had liked to. But I think that's a lot of work needs to be done for audiologists in those areas. I also think that, again, looking back at the younger population, we are seeing some children with tinnitus. And I think especially teenagers listening to music loudly. And we are also seeing a jump in mental health. And, tinnitus can lead to sleep deprivation, which can also have an impact on mental health. And I think that we need to, work closely with psychology and psychiatry to help our teenagers that are struggling with that, because while some of that tinnitus may subside as they get older, it's really crucial at a time when a lot is going on hormonally, cognitively. Teenagers shouldn't have to miss out on what's happening in school. And I think the struggle if they're not getting enough sleep or if they're having this constant ringing in their ears. And so I think audiologists really could work closely with the primary physician, could work closely with psychologists on figuring out different techniques that we can give to teenagers to manage that. Because at the end of the day, it's not necessarily, we need to teach teenagers that it's the perception of the tinnitus, not necessarily our reaction to the tinnitus. And then lastly, I think one of the beauties of New York City is the fact that there are so many languages spoken in this city, and only 65% of household English is the first language. I think audiologists need to sort of branch out in our awareness and resources to the other cultures and languages that we, serve. I think about my own family. One of the reasons why my parents were such good advocates is that they really taught themselves on how to, work the school system, then know what to ask for and educate. And I think about a family where English is not the first language, where it's a single, parent household, or it's, an immigrant, or, they are working multiple jobs. And then somehow they should also know how the school system works and what's the best fit for their child and how we can get all the accommodations. That's a very stressful and overwhelming process. And again, audiologists really need to play a big role in helping those families. I don't think it's just to children and families. I also think we see it again with nursing homes, and I think we see it again with our elderly patients. It's really crucial that we can provide the resources in all the different cultures and languages that is spoken in this city. I think Alexis will take it away in terms of, as a student, what the future of audiology is. And we can take it from there.
Yeah, hi everyone. As Sophie had wonderfully mentioned, there are lots of ways that the field has changed. I know personally, seeing my brother grow up with the body processor to BTE type cochlear implants, the field is drastically changing. And I think that as a current student and almost professional, it's really important to really focus on some of the hot topics that are within the scope right now. And to really focus on advocacy. I think that our field is very, very, very small. And one of the main reasons why HLAA is incredible is because of the advocacy component that everyone focuses on the overall mission statement. And I think that it really comes down to where is the field going to go? We need advocates, and we need students to act as advocates, not only for their patients, but for the field in general. So one of the acts in Congress right now that is focusing on getting audiologists to be recognized as their own practitioners is called the Medicare Audiologist Access and Services Act. Right now, we're not recognized as our own practitioners. And that's a huge barrier, not only for access to services, but also how are we going to get patients to know that we are the hearing healthcare professionals. So really making sure that we are going to Congress and really acting on behalf of our patients and our future is really important. There are certainly several other legislative components to audiology right now, but really going above and beyond, not only advocating on the national level, but advocating on the local level. How can students get more involved within their communities? How can we make sure that we're navigating, the busy, noisy streets of Manhattan to make sure that our patients are feeling that we hear them? Another hot topic within audiology right now is over-the-counter hearing aids. And this is something that, audiologists right now, it's kind of murky waters to say, because a lot of hearing audiologists who sell hearing aids, that goes down to the point that Dr. Weinstein had said, we're not just hearing aid technicians. And I think that this is really going to push our field to making sure that we're not just focusing on the technology, but we're focusing on the patients. Over-the-counter hearing aids are going to be available on the market soon. And yes, it's going to kind of strive people to get away from purchasing the current hearing aid technology if they are candidates for over-the-counter hearing aids. However, they are going to be beneficial for many, many, many patients. And then how can we utilize our services better as practitioners and not just hearing aid salesmen? So really focusing on oral rehabilitation and any types of communicative modes, and to really be there for our patients and hearing how we can help them, not just on the technology level. I also wanted to mention telehealth is a huge, huge, huge thing as we've seen from COVID, and how can we utilize our services to better access our patients. And I think that, there's still very big majority of people within the United States, around the world, that can benefit from our services. How can we reach those communities? How can we implement our services there? And I think that telehealth and really utilizing that and counseling services via telehealth is really huge, and something that patients can't come into the clinic. It's something that's really, really great for audiologists to use, for our patients to be aware of. And something on the national level that I know that the Academy of Audiology is really working on, as well as other organizations nationwide, is the issue of diversity and inclusion. So right now, our field of audiologists is comprised of 90% white women, and that is not representative of the population that we serve. So how can we better advocate for our profession and advocate for future audiologists to make sure that we're representing the patients that we serve, and to really address some microaggressions that exists within audiology. It's not fair for patients who are, as Sophie mentioned, coming from different cultures, different language backgrounds, if we're not giving them the best patient services, utilizing the best communication mode that they prefer. So how can we as audiologists, for future audiologists, really focus on being more inclusive, and really getting the best, obviously practitioners, but making sure that we are a diverse profession. And I don't know if there is anything. I think those are the big three. I know I mentioned telehealth too, but
Are there any questions?
yeah.
Dr.
Many
Weinstein,
thanks to,
I think you're on mute.
Muted. So I'm sorry, it was suggested that we leave some time for questions, and maybe we want to take notes, because hopefully you'll offer us a to-do list in what we can do to help you folks and to advance the profession and the young people coming out further to help everybody, persons with hearing loss. So John.
so many thanks to Barbara, Sophie, and Alexis for this informative discussion and for raising, I think, some important issues that we certainly share, the concern about diversity and inclusion, and we haven't really figured out a way to make HLAA more inclusive. And I think your interest in, in your practices in improving interactions that will be friendly to all our entire population is important. But then there's also the question of how to increase the diversity in your profession and how to increase the diversity of people who are coming to you. So that is certainly one thing I would like to hear you talk about. I would just like to make one comment also, that Barbara talked about that the relationship between the audiologist and the patient is a partnership. And I certainly agree with that, but I think it's important for us as patients to recognize that's a two-way street, that we need to provide information to the audiologists in order to allow them to function better and to help us better. I know that I've sort of been a pain in the butt to audiologists by asking them to make adjustments, but I think about my father at the end of his life. I would take him to the audiologist and he would say, "I don't like the sound." Well, that doesn't give the audiologist anything to work with. And I think that we all need to find, as patients, ways that we can partner with the audiologist to help them do their jobs better. So as we move on to questions, I would, if you want to ask a question, as I said at the beginning, click on the reactions tab at the bottom of the screen, then click on raise hand. You will need to unmute yourself to speak. In order to give as many possible people a chance, we do request that you keep your questions to 1 minute. So if you need a follow-up question, you'll be given an additional minute. I see a couple of hands up already, starting with Catherine.
Yeah, this is a complicated question. I'll try to do it in 1 minute. So you both talked about telehealth. You both talked about over-the-counter hearing aids, and which I think are really, two ways that audiology is going to be able to be much more accessible to a whole lot more people. So how, though, are those two things going to work economically for audiologists? I had a telehealth appointment today, not with an audiologist, somebody else. And for me, it was great. It was 15 minutes. I was finished. I didn't have to go down there. I didn't have to go home. But for my doctor, she did exactly what she would have done if I was in the office. And I assume she will charge me for the same she would have charged me if I'd been there in an office. Has there been any discussion about how this combination of telehealth and people buying over-the-counter hearing aids and then, needing the services of an audiologist, how this is going to change the profession economically, how it's going to make it possible for you all to earn enough?
So I work at a hospital setting. However, I have a lot of opinions about private setting, even though I have never run a private setting or opened a private setting or have any idea of how a private setting can work.
But Sophie and Alexis did for 1 year work in a private setting during their
Yes.
study.
So we
That's
have had exposure to a private setting. I will say that I have always thought that the framework of the private setting has always needed to be shifted away from the sales of hearing aids to the rehabilitative or habilitative work. And I think that if we start shifting that focus, it gives us a bit more credibility of hearing health professionals, and two, it becomes less about the device itself and more about the treatment of how we can help the person hear better. Because it's not just about putting a device on them, it's also about teaching them how to wear the device and the best circumstances they can have with that device. So if we start shifting it to a more habilitative focus, which I think is hard because we can't get billing for that in a lot of places, but I do think it will shift the focus and help I think audiologists will need to, consider over-the-counter hearing aids as part of their practice. It's coming, it's happening, people are going to want it, and we need to be open to that.
That's a great answer. I hope you can do it.
And I'll just quickly note that our scope isn't just hearing aids. And I think that audiologists get very much in the framework, like sell hearing aids, make money, sell hearing aids, make money. Our scope encompasses so much more than that. So really thinking outside of just hearing aid technology, how can we utilize our skills in a framework that's going to benefit the patient, say an OTC buyer, but really focus on that oral rehabilitation aspect or the diagnostic component or the vestibular component. There's a lot of different avenues of audiology. And I think that it's going to force the field to really shift out of the mindset of this buyer-seller framework and make it more accessible also in the future for patients.
So I just want to add, Ruth said that when she went to CHC, they programmed her hearing aid remotely. That's great, and that's being done, but that's not easy for a lot of people who are not technologically sophisticated. I see the applicability of telehealth is more of the interaction between the clinician and the person with hearing loss and the family member. So I think that we should be using telehealth and leveraging the technology to work more with people to make sure that once they get the hearing aids, we have to, are you wearing them? What situations are you wearing them in? And I think that's the way telehealth can be leveraged. Jerry's raising his hand. And then I think that in terms of billing, if audiologists are going to have to start unbundling. And that's the big challenge, Catherine. And that's where audiologists feel uncomfortable because right now you come to an audiologist, they're not going to necessarily charge you individually for the hearing test or the hearing aid fitting or the hearing aid, you get one price. But audiologists are going to have to start unbundling and start charging for the interactions that they have with the patient. Telehealth at this point, during COVID, for cochlear implant for kids especially, people were reimbursed for telehealth. That stopped, but that did happen. And in terms of the as we move forward with the OTC, we're going to be seeing more and more people are going to be more confused, and they're not going to be able to necessarily do a lot of this on their own, and that's going to encourage them, I think, hopefully, to realize that audiologists are going to have a role to play. Hopefully. I see Jerry's looking like he wants to talk or is talking to somebody else.
A follow-up question,
okay.
really. I was taken by Alexis's reference to the MAASA bill in Washington, which she said would allow audiologists to bill as practitioners. My follow-up question is, why can't they do it currently? Is it only because people won't pay for services rendered? Or is it because of the traditional practice of basing the economics of the clinic or the office on the sale of hearing aids? Because the other thing that's beginning to wear down the barriers is what's called blended distribution, which are middle people online who are offering audiologists services, and then the delivery of hearing aids customized at considerable discount. So I just wonder, if I'm a psychologist, I get a graduate degree and I can hang a shingle tomorrow. I don't know how much licensing I need. But why isn't it the same? Is it because of the law?
That's an excellent question. I could start off by sharing that audiology, it just recently shifted to a doctorate degree. So in the past, audiologists, after 2 years of getting a master's degree, then they started treating patients. However, and it shifted recently to being a doctorate degree. And now it's a 4-year program where we get an AUD, which is different than a master's. However,
from a PhD and different from a PhD.
And different from a PhD, yes, of course. However, we still have to bill under medical professionals. So there's still that gray area of, well, we are medical professionals, why can't we bill by ourselves? So we're still trying to advocate, and I think that it's a wonderful question and something that I'm still learning about as a student. Why is it the case? And it really comes down to how can we advocate to make sure that we are being recognized as the medical professionals. Dr. Weinstein.
And also the thing is, in terms of billing, in order for Medicare will only pay for hearing tests if it's recommended by a physician. So audiologists can't even bill for bill Medicare for a hearing test, determine if they need some sort of intervention. So that's a real problem. So we're trying to become independent, recognized as independent professionals, direct access. And the same thing, like you'll see most of you who get cochlear implants, most of the people you're working with who get cochlear implants are affiliated, most of the audiologists that are activating are affiliated with the hospital, because audiologists in private practice cannot get reimbursed when they're working with people for cochlear implants. So there's no billing for people in private practice, which is why you don't see that many audiologists in private practice working with individuals with cochlear implants, which is a huge problem.
Really? You can't, if you have a cochlear implant and it's covered under Medicare, you can't bill it unless you're hospital affiliated?
The way Sophie, were you going to say something?
I don't think it's necessarily that. I think it's more of the fact that private practices normally would have to have an ear, nose, and throat doctor that would be doing the cochlear implant. And a lot of times they're affiliated with the hospital. And then whatever kind of program they're doing in the private practice, they would rather go to the hospital where all the services is included and all the connections between the doctor and the audiologist. I think that's really what's more of the case, as opposed to a private practice, then go to a hospital, then go back to a private practice. I think it's just easier if everything is done in one place. I think that's
But also the
I get-
billing is, but the billing is out of the hospital.
right.
Yeah.
David?
Great. There's a question for Sophie specifically. As an audiologist with hearing challenges, I'd be very curious to hear what your professional challenges are. Like the obvious question for me is speech audiometry, how challenging that might be. And I would love to know what challenges you face and what coping mechanisms you have to address for your professional experience, life, responsibilities.
Yeah, I definitely face a lot of challenges. I think COVID has definitely exacerbated a lot of those challenges. In terms of speech testing, I do speech testing a traditional way, but I have a monitor speaking, so it's loudly for me. I don't mean to brag or anything, but I have a pretty good speech recognition score myself for my hearing loss. But I think the challenge is definitely with COVID and the mask has definitely really made it difficult. So I use my phone as a streaming service where I have the phone in the booth with them so that I can hear better. I do a lot of play audiometry with another audiologist where either I'm the tester or the second tester. And again, I use my phone as that streaming service so I can hear both what's happening in the booth and also hear my coworker on the other side of the booth. Lately, I was just telling these guys 2 weeks ago, I had an ear infection, so I was working off of one hearing aid. It was extremely challenging. I was exhausted at the end of the day. I really was an unhappy camper for 2 weeks. I felt bad for my coworkers, but they were really great and helping me, checking in on me, and I really appreciate them for that. But didn't quite recognize as much because I was always running around. And I sort of just said it was because I was running around is why I'm tired. But now I'm not running around as much. And I definitely think at the end of the workday, I am tired. But I'm surrounded by people that are very understanding and go out of their way to make sure that I'm engaged with them. A lot of my college friends are very understanding, and a lot of my graduate school friends are very understanding. So if I'm in a loud situation, they are always checking in on me. So I really appreciate them for that. But did that answer your question?
So Sophie, David, just let me add, but Sophie also indicated when she was a student, and she said at the end of the day, because the listening effort that she has to put in to focus on people when they're speaking, to look at people's lips, and just, it's exhausting at the end of the day. And you did say to me, I don't know if you recall, that one of the reasons why you got your dog was because you want to feel the need to take your hearing aids off when you get home, and you need to rest your ears.
Yeah.
And your dog really kind of helps you, which was, I thought that was really very profound when you expressed that.
I will say there's something a bit ironic about me choosing a profession where I'm focusing on my weakest skill set and my weakest point, but I wouldn't change it for the world. I do like the work I do, and there are times where I have to be careful about drawing that line of my own personal experience, because my experience is not everyone's experience, and I want space for people to share their experience, and I want to be there to listen to what they're going through, because I may not have had that, but I can have some sort of varying degree of understanding. So there are moments where I share about it, and then there are moments where I don't. I always choose and pick where the good moments to share about my personal experience with my patients.
Yeah, and it's interesting that it used to be that, so I've been in the field since 1976. That's when I got my master's. And then I got my PhD in 1980. And there was one person that I knew who had a hearing loss and who was an audiologist, who is now my colleague, who's been a colleague for over 30 years. But and so I've been teaching since 1980, and it's only within the past 5 years that about once a year we have perhaps one student who's coming into the field that has a hearing loss. So in terms of inclusivity, we need to attract more people who have hearing difficulties into our field. But as you suggest, David, it can be a problem. The hearing loss can be a barrier. But it's nice to see, because I think that when you're experiencing and living it, you make the best, or have a family member that makes for the best audiologist, because you have the compassion, the empathy, and you know how to work with people who have difficulty hearing. Ruth?
Ruth?
Sophie, I just want to thank you for pointing out the fatigue factor. And I hope that all audiologists share that information with their clients. I don't think people really realize how much energy you're burning, your brain is burning when you're not hearing well. So I also want to say that you sound like you are very good at technology, and I hope you share some of the methodologies that you're using, because they sound very interesting. And I also want to tell people that I had a cat who was not trained but knew exactly. She would butt her head into me when the doorbell was ringing, when
Wow.
the phone was ringing, and she was never far away because she understood that I couldn't hear.
Wow.
I wrote a story about it called My Ears Have Whiskers. So, but I think animals in general are very sensitive to the needs of their owners.
So in terms of listening effort, I mean, whenever I recommend to somebody to get a hearing aid or a cochlear implant, starting with a hearing aid, I always say to them, just notice how tired, if you're less tired at the end of the day, try to focus on that listening fatigue and listening effort. Because I just think audiologists don't talk enough about it, but my students, I talk about how we should assess listening effort before when people come in, when patients come in, because that's a change in behavior that we can measure once they've gotten some sort of assistance in terms of the hearing. So listening effort, it's new to our field, so it's been in the past 5 years, but more and more people are talking about listening effort. And in my opinion, it's part of a hearing aid assessment. It's part of a cochlear implant assessment. Even my sister-in-law who's here, Martha, and even Phyllis, when I spoke to Phyllis, who got a cochlear implant, I just said, listen to see if you focus on the listening effort, see if you're less fatigued at the end of the day, because that's really that's an important test of the value of the intervention.
I often think that hearing loss is an invisible disability. I think people don't recognize how challenging it is because it doesn't appear in, physical ways that people would like it to. I think people, they see glasses, they don't question about putting on glasses or any of that. They don't question about other sort of disabilities. But when it comes to hearing loss, it is considered an invisible disability, and it's challenging. And I think audiologists do need to give them that breathing space to recognize and validate how patients are feeling at the end of the day.
Catherine, you have another question?
Can I ask another question?
Yeah.
So yeah, Sophie, I think that, what you bring to your patients in terms of understanding and empathy is Fantastic. Because it definitely means much more coming for you. And I think many audiologists don't even really realize they need to say that. But that said, I'm wondering if there is some technology that you can think of that could take away some of the need for that precision hearing from you. You know, some kind of speech recognition technology on a much higher level than we see it now. But that would allow you to sort of double check your own perceptions of what you think your patient has said in a hearing test, especially in a word recognition test.
Yeah, I mean, before COVID, I would like to think that, I mean, before COVID, when there were no masks, it was no problem. I am a huge lip reader. I did the combination of hearing it and lip reading. I felt very solid about my scores. Even today, I still feel pretty solid about it, but I do agree that there is room for growth in technology when it comes to testing and doing diagnostic testing. I think, you know, what could it be? The only problem is I don't want to rely too much on that, right? Because if you rely too much on that technology, then you are less of a sort of an audiologist and more of a technician, I guess. You know, I think it's a good question. I do think that when it comes to speech testing, it's challenging if you're going to do something sort of automated or some kind of technology to help, because if you think about people with hearing loss, there will be different speech impediments, right? Or if you think about even the number of languages that people speak. I mean, when I do it in Spanish, we have patients that speak Spanish differently from the Dominican Republic than someone who's speaking Spanish from Peru, right? Those are very different, or from Puerto Rico. Those are very different ways of speaking Spanish, and the way they say the word is different. And so using some kind of technology for that specific part of the test may be challenging because of that. But it's something to look into and think about. And I don't, you know, it's probably somewhere in our near future.
Yeah, I also just wanted to mention briefly, my brother, who is a bilateral cochlear implant user, is actually going to be a physician's assistant. So, you know, working on that aspect of it and seeing where technology is going and really utilizing how can he hear a patient's heartbeat, for example. That's something that a normal hearing person doesn't even have to think twice about. For him, it took a very, very long time to actually hear that lower frequency. So how can, I guess, audiologists, in addition to other professionals, think about how can we make the other disciplines that we're not even thinking about, people who are going to be in other healthcare professions, in other settings that are really noisy and very hard to hear, how can we advocate for those professionals better, especially for those with hearing loss? So
Alexis, had your brother looked into this? I have to get the website, but it's for physicians with
Yeah.
stethoscope for cochlear implants. He had that?
yeah, he's gonna outreach to them,
Okay,
I believe.
yeah.
But thank you. Yeah, I probably still ask you for the website, but yeah.
Yeah, I'll get it to you. I'll send it to you.
Thank you.
Jerry? You're muted, Jerry.
Yes, thank you. I was muted, sorry. Yeah, Alexis, in response to your point, I think we have to just overall, all of us, raise the visibility of hearing disabilities. And on the medical side, I think that there needs to be more signage about assistive technology. It's ironic that if you want to make an appointment with an audiologist, you have to make a telephone call, right? I mean, think about it. I've been trying for a year or more to get my cochlear implant center, which shall remain nameless, but is NYU, to install a portable hearing loop
Right,
the
exactly.
counter. So when
It's
people
unbelievable
come
that they
there,
don't have it.
they
It's
can
unbelievable.
hear.
It's
You know,
unbelievable.
And the other huge thing is what John mentioned at the beginning, which is captioning. So many of us are so appreciative of captioning wherever we can get it, on television, in the theater. As John mentioned, now, as of May 15th, in New York City movie theaters, during a weekday and weekends, every movie has to do that. And Shari Ebert and others have blogged about the importance of captioning. I was taken by Shari's comment, or maybe it was Alexis, that only 65% of New York City households speak English. Well, there you go. There's a whole audience for captions, because those people can read, or the technology might even enable them with their smartphones to get captions in their native language. So there's all of these things, but it takes a village. It takes everybody's effort, and legislation is only one part of it.
So I wanted to ask Catherine, because this telehealth is like very, very important in terms of accessing all types of forms of healthcare. But my understanding is that a lot of times when physicians do telehealth, it's a private software, and it's protected. And I don't think that a lot of the software has captioning, because you're not doing telehealth through Zoom, which has captioning, for example. But it's so, I was wondering, Catherine, did you have captioning available when you had your telehealth appointment?
No.
Yeah, so that's an interesting thing. That's unbelievable to me.
No, I know. I put my phone on my laptop and set it to Otter.
Yeah, you did set it to Otter. That was smart. Yeah, okay.
But nobody, I know that, but how many people would know or think to do that?
Right.
So
It's just amazing that on these sites that they don't have the captioning, for the telehealth. It's really, it's quite something.
yeah, and it's a lot of psychotherapy is going on with telehealth now too, and I just wonder, how those patients are managing. But
in response to Jerry, I think we had to fight to get a cell phone here to be able to communicate with our cochlear implant patient. We finally got it. So now we have this department phone, cell phone, and we give our patient that number so they can contact us, whether it's appointment or any issues that they're having. But it is it's wild that we have to fight for that kind of a department that literally is helping people that cannot hear, that we have to make that argument.
Can I add something to that? The telehealth appointment I had today, I was at an NYU physician, and I made the appointment on the patient portal, and it offered, the option to come in or to do it by telehealth. I didn't say a word to anybody. And it was all
That's true.
incredibly easy.
That's true.
So I don't understand why that's not done every place, especially in audiology offices.
Yeah, that's interesting. That's interesting, because probably even on the NYU portal, I don't think they have audiology there, but they have the the MDs and all that, but that's interesting, yeah.
I don't have an NYU audiologist, so I don't know, but.
Yeah.
I want to ask a follow-up question. How many audiology clinics have hearing loops installed in them, so patients that are being fitted for the first time can see how a telecoil can benefit them in public places or with the use of a neck loop?
Well, I'll just say this, that it's remarkable to me that when you go into an ENT office where there are audiologists, there's not a portable loop right at the desk, at the front desk, obviously. And I would say that most I can't say for sure, but I would say most audiology clinics are not even equipped with the loop, and some of them don't even have, when you're trying to do a Bluetooth connection, some of them you can't even check the hearing aids and make the connections in the suite. So we're behind the top. But have it in hospitals. The thing that's interesting is that they have all these different languages. You can get a Chinese, you can get Japanese, you can get all these different languages. And what they say for people with hearing loss, an ASL interpreter. But how about some sort of a hearing assist, like the loop or a personal amplifier, which is crazy that they think that people think ASL, everybody's going to be communicating via ASL, and that's an assist, which is a real it's a real issue.
how about providing Otter or some other AI have a small screen so that it can be translated and people can read it?
We have
Okay.
iPad translators.
Right.
And then where you can call for multiple languages. So let's say we have a patient that where the kid is a signer, the mother is Spanish, so and then I'm English, and so you have like a three-way conversation, very long appointment, but and then you can have captioning at the end of it.
Wow.
Nancy, you've been sitting there very patiently with your hand up.
Yes, thank you.
Oh,
Well, I don't have anything very long to say, except the umbrella of inclusivity and visibility opens really, really slowly. But in the time that I've been part of HLAA, I have seen a lot of progress. We still have a long way to go, and that's why God created HLAA and organizations like that. And I think that people who join the field of audiology with either hearing loss or know a family member or friend with hearing loss is so important, because they're bringing the experiences of what their patients are feeling on a daily basis. So I applaud Sophie, Alexis, and Barbara. You're just a star in that field. And what you're teaching is really instilling in these new people that are coming into the field what it takes to be not only an advocate for those with hearing loss, but what it takes for them to be compassionate towards those with hearing loss. So thank you all. It was a very enjoyable presentation. I appreciate your time.
I don't see other hands up, but before we leave, I just want to ask one question. I know that's one that Jerry will appreciate, and it relates to what we were talking about a minute ago. I know many
David's hand-
people who have
David's hand
gone
is
to,
up.
oops,
David
Excuse me?
has his hand up too. Yeah, David.
what were you saying, Catherine?
David has his hand up as well.
Okay, well,
Yes.
I'll just finish my question. His hand was not up at the time it started. It relates to the question of telecoils that I know numerous people with, a lot of resources who've gotten hearing aids, and I assume have the ability to go to, top audiologists, and their audiologists seem not to have mentioned T-coils to them. And I know that's something that, that Jerry has wanted to see legislation, not that they have to sell you a T-coil, but that
Oh, it is
Legislated. It is
required to
legislated. They have
inform
It
to.
is
the person.
legislation, John.
You have to. It's legislated. New York State requires that
It's
all
just not-
audiologists talk about
There's no
telecoil.
enforcement.
Yeah, but there's no enforcement. A lot of audiologists don't talk about it, but it's legislated. You have to have a
is
sign in your
legislated.
office, and you have to have a sign in your office about it. Yeah, it's legislated.
Oh, great. That's good to know. Thank you.
Yeah.
I'll say this too, John. I'm on the dispensing board of the state. If anyone knows an audiologist who fails to tell their client when they dispense the hearing aid that it can come with a telecoil if they wanted it, just let me know and we'll get that person fined.
Yeah.
Okay,
No,
thank you, Jerry. Thank you for better informing me about that legislation. David, sorry to have preempted you. Go ahead.
Not a problem. First, I didn't know this was legislation either. That's cool. Good to know. I wanted to ask about this iPad translator captioning device. My big question is, how do you use such a device and maintain HIPAA compliance? I'm
So
always wary about these issues.
Right. So this is a hospital-wide thing. Montefiore across the hospital has iPad translators, as opposed to you can use the phone, but you can also have the iPad translators. So it's the same concept as using a translator on the phone. It's just with the iPad. So we have it across the hospital, and it's really, really helpful for the different patients that really can't hear, whether they're an inpatient or they're coming to outpatient clinics.
But is this an artificial intelligence?
No, it's a
translation?
person. It's a
Oh, It's
person.
an actual
Yeah. So
Got
you have like a whole list of languages, and you click on whatever language it is, and it's an actual person.
Okay, that's complicated, expensive, but makes sense. Okay,
Yeah, I mean, we only have one out, like on our floor, we have, I think, 2 or 3. It makes sense that we have it because we're dealing with ears and people who have hearing loss. But you know, at the other location that I work at, we have at the Children's Hospital, they have a couple there, but they're kind of scattered. You kind of have to go digging for it, but they're extremely useful.
Thank you. Any other questions? Okay, in that case, again, I'd like to thank the 3 of you for a terrific presentation that was very informative, and to thank Lauren, as always, for her expert captioning. If you want to learn more about our chapter, or to donate, you can go to our website, which is hearinglossnyc.org. We will be having elections to the board at our open May 17th board meeting. Our recent issue of News and Views had an error about that. The elections will be on May 17th. We will be sending out some kind of, or posting link to register for that meeting. If you're interested in serving on the board, please email us at info@hearinglossnyc.org. We are also beginning to think about next year's programs. Please email us there if you have a topic you'd like us to consider. And lastly, on June 7th, we will present the 2nd annual Albert B. Chen Scholarship to a senior with hearing loss. Al and the winner will each speak for a few minutes, after which we will hear from Christopher Caulfield, who was born in Champaign, Illinois, with profound deafness in both ears. He received a cochlear implant on his left side when he was 16 months old. Because of complications from the surgery, his family opted not to give him a second implant. He graduated from Rochester Institute of Technology, where he earned a bachelor's degree and published 2 research papers in the field of human-computer interaction and accessibility. Instead of pursuing a PhD, he attended Cornell University for his master's in computer science and worked on his first startup, which is still running today. Christopher is now a product manager at Microsoft on the Xbox team. He will talk about his experiences in academia and in the workplace as a young person with hearing loss. I hope to see all of you then. If you know younger people who would be interested, please tell them about this meeting. And again, thank you to all, and good night. And Jerry is sticking around, and David said he would stick around if you have any questions about the legislation Jerry spoke about earlier.
Thank you.